Hey folks, Dr. Dan here. Thanks for joining us today on DocTalk. We're going to have a great show. It's one of those shows that we enjoy doing. It's talking about calving disorders. Dr. Matt Miesner from Kansas State's Veterinary Health Center is going to be here. It's going to be a great show. You're going to learn lots. I'm going to learn lots. We'll see you after the break.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Matt, welcome to the show.
Glad to be here.
Folks, this is Dr. Matt Miesner. He's here at the Kansas State College of Veterinary Medicine. He's over in the Veterinary Health Center, where he is an associate clinical professor in the Department of Clinical Sciences. And Matt, we're going to talk about calving, and we're going to talk about, and that's all right, you're a clinician, the beeper's supposed to go off. That's when we get somebody that's in action, he's on call, it's probably a dystocia, we're going to have to take a break. No, just joking.
Sound check.
That's all right. Let's talk about calving and normal calving as things progress. You know, I think that the one thing we always kind of lose track of time, we lose track of what's going on with that heifer, but there are different stages, right?
Right. None of them can read. I've never not met a cow that could read a book yet, but there are some predicted times that we need to look at, and times when we need to act, and times when we just need to leave them alone as well. So, you know, we go through stages, and there's 3 stages of calving, and the whole process is what I would call is prep, push, and placenta. You know, it makes it pretty simple. So the first stage is stage 1, which is prep phase, and that's leading up to it, and all the things are getting relaxed, and the cow's getting ready to make enough opening to get this calf ready to go. And then there's the push phase, which is the actual labor, and then that should be pretty quickly. And then the third one is the placenta, and so after that the placenta should pass, and we should have some time for the cow to get ready to raise the calf. You know, so when let's get into that prep phase, and I assume that's when she starts to go off by herself and different behavior and isolation. You know, some people, if you see them in a stall, if they're confined, they'll kind of nest, they'll kind of do those kind of things. Cows are experienced at this thing, and it's pretty fast, and sometimes we don't even notice it. You know, one day she looks okay, next day she's got a pretty good udder, and everything's starting to look relaxed, and man, you're ready to go. Heifers, you know, learning the ropes, it could take weeks, you know, sometimes for this to prep. Udder filling, ligaments loosening, all that stuff, so it takes time.
And then, so that has a real varied response, and there's no hurry there because we're getting cervix dilation, and once the cervix gets dilated, then we enter that push phase.
Right.
Is there more of a time once they start pushing?
Yes. So again, cows most of the time, sometimes it's just a cough. Out comes the calf. So within a half an hour, once they start, that water bag breaks and they start pushing in the cow, they should be out. I mean, pretty quickly, within a half an hour usually. And then the heifers, you know, they take a little time. Got to dilate and loosen things up, and it could take up to an hour. But the bottom line is, in that push phase, if things aren't happening pretty abruptly within an hour, we need to intervene. And sometimes it takes a heifer longer to get it out. But I like that hour kind of cutoff.
Cool. Well, now that we've kind of gone through normal calving, that'll lead us in right after the break. We'll talk about some of the dystocias.
Right.
All right, folks. Thanks for watching DocTalk. More with Dr. Matt Miesner after this.
Grain sorghum is one of the most important cereal crops worldwide, and Kansas leads the nation in its production. Over the years, sorghum has been either exported, used in animal feed domestically, or for other industrial uses. Recently, its use in the ethanol market has seen tremendous growth, with 30% of domestic sorghum typically going to ethanol production. Kansas Grain Sorghum is committed to sorghum research, market development, and education. Learn more at ksgrainsorghum.org.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
DocTalk, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner, and we're talking about calving disorders or normal calving, and now let's move into dystocia because we got to the push phase. We've waited 30 minutes and nothing's happened. And as a producer or a rancher, what's the first thing we need to do?
Frequent checks. I mean, having a plan. I mean, is it going to be now? We've watched her and we've seen if she's going to have problems. Is she showing signs of stress? Is she really laboring on this situation, or is is she just kind of pacing? But having a plan for restraint. Getting her caught, squeeze chute. Set of panels or a rail that can be opened up someplace to safely get her restrained, and then do a good exam. And most of that is having a good visual and maybe even palpating exam, kind of cleaning her up and making sure everything is coming through the birth canal okay, if you're comfortable with that. If not, that's the time to say it's time to call the veterinarian and have them do that. But, having that ability to have her restrained safely certainly helps the veterinarian be more efficient if need be at that point in time, and can get a good exam. Make sure everything's positioned right, nose, front feet, and everything's coming through the canal. Sometimes intervening there is the easiest way to go.
Yeah, and that's the other thing. I think that we overlook the restraint part, because there's nothing more frustrating than a cow she's trying to have a calf. She doesn't know what's going on. She's getting up, she's pushing, she's getting up, looking around to see where the calf is. And then when you show up as a veterinarian or as a producer, you're trying to figure out, how am I even going to check this thing?
Yeah.
And the safety of you, your family, your practitioner, and the cow is important.
Right. Yep. And having a way to easily, efficiently get her in there too. Not having to work her too hard to get her to a point to restrain her. So planning ahead, that's part of the calving problems that we're looking at. So as far as these dystocias go, and then there's plenty of producers out there that are have delivered tons of calves, but there's always going to be that one that you're going to go, something's not right, and things that we see as veterinarians, or especially in the clinic, is the odd ones. And I've seen things where we've had twisted uteruses or uterine torsions, and some of these conjoined twins, and the bizarre things that they're still the most experienced producers. And then goes in and just says, whoa. At that point in time, if you have the ability and you have a good relationship with the veterinarian, it's probably a good idea to call them too.
I thought they just, the experienced ones called us when it was snowing or
yeah.
when it was raining was more than they had seen.
It's always good to call early, because veterinarians at this time of year might be traveling the ridges doing a lot of this, and so it's nice to have them be able to make a plan. They might be on their way by that direction.
So when you reach in there, you want to feel 2 feet ahead.
Right. Yep. And then we got to figure out which feet they are, and look at the way that feet bend. The front's knees and fetlocks bend the same way, and the backs are opposite. And so there's a bunch of just systematic exams that we do at that point, and knowing if that calf's going to make it through that birth canal. It might just be a giant calf, or head turned around. There's a whole bunch of different situations that we can get into and make a plan. And at that point, we want to see progression. And so once we start, then I go half an hour time.
Cool. We're going to take a break, folks. When we come back, more with Dr. Matt Miesner on calving problems.
The BQA Tip of the Day, sponsored by Beringer Ingelheim Vetmedica, Inc.
I'm Dr. Kipp with Production Animal Consultation. Today's BQA Tip of the Day is proper storage of micronutrients. So today at the feed yard we're at, what we have here is we have our micro ingredients such as rumensin, our Thailand in the feed, our micro minerals such as Vela4 and so forth that are going to go into the micro machine. We just have to understand that when we store these ingredients is that we never store them next to insecticides or other chemicals that are not to be in the feed. These things have to be stored by themselves and in an area that is dry, temperature sensitive, and has humidity control as well. When we feed these things or put these things into the micro machine, just make sure from a safety standpoint that we utilize dust masks, gloves, so we don't get them on our skin, because sometimes they can be very sensitive, as well as just inhaling the product because they are very small in size and the dust can get into your lungs and so forth. So just use dust masks, use gloves, and then always store them properly.
Next time you see a beautiful field of corn, reach out and thank the farmers who work tirelessly to raise corn for livestock feed, renewable fuels, and exports to feed a growing world population. The farmers on the Kansas Corn Commission work for Kansas Corn with grower-funded checkoff dollars that support foreign and domestic market development, research, promotion, and education to expand opportunities for Kansas farmers. To learn more, visit kscorn.com.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Buying a car shouldn't be this hard. And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome.
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information. To see this show and past episodes of Ag AM in Kansas, go online to agaminkansas.com. DocTalk, brought to you by the Kansas Soybean Commission, the Soybean Checkoff, progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner, and we're from the College of Vet Med at Kansas State University. We're talking about calving disorders or getting that live calf on the ground, and we're talking during the break. You have 3 goals.
Right. Number one is, to get me a live, viable calf, so we want this to be efficient and easy on the calf. Number 2 is preservation of the welfare of the cow, so pain, welfare, distraughtness, all that kind of stuff. And then 3rd is maintaining her future reproductive soundness. So we don't want to injure things bad enough that she's not able to breed back. So I have those 3 goals going into each one of these situations.
Yeah, and we want to keep her in the herd, and and then the feedlot dystocias, we're worried about the heifer, not necessarily the calf. Because we're in the business of producing beef.
Right. And so the best way to do this is to be efficient. And so I look at my watch, it's time flies when you're having a good time, and I want to be having some sort of progress about every 15 to 30 minutes. So If I need to get a leg up or a leg head's turned around, I want to have that lined up and ready to go within 15 minutes or half an hour. And each stage, whether it's breech, you know, we have a tail or we have a posterior, I just want to be sure that I'm getting things moving out the back end efficiently. And if I'm not, then it's already been discussed as to what is plan B. Is it a live calf? Is it a dead calf? When do we go to a cesarean? And it's been shown pretty often if we have a decent facility, a sooner decision for a cesarean is usually a good one. Cow's in a better shape, calf is in better shape. All in all, if we have the right situation, you know, for a cesarean. So
well, when we're talking about the beef prices,
yeah,
where they're at, a cesarean section, folks, is nothing on the cost for what getting a live viable calf that you're going to sell that's going to be $1,600 at the time of weaning.
Right. Yeah, and if you're able to do a good, efficient C-section with a cow in better shape, her chances of breeding back are a lot better than waiting too long. You know, so keep it going.
So a cesarean doesn't necessarily preclude or decrease the reproductive efficiency.
Right. Not if it's done efficiently and the decision's made a little bit earlier on, and you have the right setup to do it. It doesn't do that to it.
And a lot of times, if you're wanting to help that veterinarian or help the cow, sometimes just loading her up and bringing her to the veterinarian, you know they're going to have the right facility. You know they're going to have the equipment there. You know, you're dealing more on your time schedule. It's something that I see more and more is the hauling clinic.
Right, and more efficiency, so a veterinarian can do more at once. You have all the medical equipment that you need to revive that calf. You know, a whole bunch of different medical interventions you can do at the clinic. Plus, everybody's warmer and drier and all that kind of stuff. But in the end, everybody benefits from that, and you do see more haul-in type situations.
Cool. Well, let's take a break. When we come back, let's talk about taking care of that cow and that calf after the calf hits the ground.
Good.
Thanks, Matt. Thank you for watching Doc Talk. More here after the break.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment.
Mackenzie Steger grew up on a farming and ranching operation in Nebraska. She loved raising and showing cattle and working with local farmers and ranchers. Her passion lies in the cow, calf, and feed yard sector of the veterinary profession. After graduation and officer training, she will report to Fort Carson, Colorado for active duty in the U.S. Army Veterinary Corps.
Hello, I'm Dr. Frank Lyons from Kansas Regenerative Medicine Center here in Manhattan, Kansas. Daryl was one of our patients that we did about 7 months ago.
I dug trees by hand for years and years and years. In the process, I wore out my rotator cuff. But when I learned about this process, I thought if there's a way to get rid of this pain, then I want to do it. So we did it, and it worked. And I'm not going to go out and dig trees with a shovel anymore, but I can do the things that I want to do now.
Well, it's been very gratifying to help people with their painful joints and other entities, and it's been especially gratifying to be able to help people who I know and have worked with and known for many years.
Grain sorghum is one of the most important cereal crops worldwide, and Kansas leads the nation in its production. A high-energy, drought-tolerant crop, sorghum only requires 6 inches of water to produce the first bushel. And with its wide uses and easy adaptation, sorghum proves to be a truly indispensable crop. Kansas Grain Sorghum is committed to sorghum research, market development, and education. Learn more at ksgrainsorghum.org.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Kansas Farm Bureau, the voice of agriculture, represents grassroots agriculture. The state's largest and most powerful farm organization stands up for its members through leadership development, agriculture education, legal defense, environmental advocacy, farm safety, and risk management. Members also enjoy money-saving benefits. To join our organization today or to learn more, go to www.kfb.org or find us on Facebook and Twitter.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Kansas Farm Bureau, the voice of agriculture. To join today or for more information, go to kfb.org or find us on Facebook and Twitter.
Hey folks, welcome to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner, and we're talking about getting the calf out of the cow. And calving season is upon us. There's a lot of excitement. Dr. Miesner is an associate clinical professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine, where he sees hundreds of cows a year, teaches this. We're fortunate to have him as a guest. It's always good to have you on the show.
Thanks.
You bring great wisdom, and you do a good job, not only with our clients and their animals, but I'm very thankful for what you do for our students.
Appreciate it.
Appreciate you. Let's talk a little bit, Matt, about the post-calving care. And we got to get to that third stage, right?
Right. So, we've got the calf on the ground, and sometimes there's some intervention that needs to be done right then and there, as far as resuscitating that calf, and even a slight delay through that pelvis can get them short on oxygen and different things. And so, there's a situation sometimes where we've got to intervene within that first 5 minutes, and we have various drugs and treatment protocols that we kind of follow with that. Get them breathing, get some air passage, and then kind of watching the cow as well. So did we have some rough birthing where we have to address some injuries to the cow? Address those right then and there. So that first 5 minutes to an hour is just getting that calf viable and able to sustain itself. And then after that, down the road several hours, the cow should be passing her placenta within 6 to 12 hours, but sometimes they'll retain. And then within that first hour or two, we really want that calf to have its first meal of colostrum too. So either he's going to be viable enough to get up and do it himself, or sometimes it's just easier just to go ahead and strip her out and tube it right then and there, or get him to take a bottle.
And the sooner the better on colostrum, right?
Right. You're within a 24-hour window, long window. I mean, ideally within 6 or 8, they need to have that first bit of colostrum to be absorbed, and then after that things start shutting down, and they don't absorb it systemically after that. So within that first 6 or 8 hour.
What's your stance on retained placentas? Because I mean, my granddad and dad, we made 100 calls a year on retained placentas.
Right. We want her to pass it on her own at all costs. We don't really want to force it out and strip it. That still shows that causes quite a bit of inflammation. So she might retain it. We treat her, support her, antibiotics sometimes, depending on how healthy she is. But most cows will eventually, get that to loosen up and fall out. It can be pretty horrendous by the time it comes out. But as long as she's healthy, I let her do it on her own. We can do some gentle help, but we don't want to clean them.
Cool. Well, thanks for being on the show today.
Thanks for being here.
Folks, thanks for watching DocTalk, and if you want to know more about what Dr. Miesner and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Remember, always work with your local practitioner on many of these issues. Thanks for watching DocTalk today. I'm Dr. Dan Thomson, and I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. To see this show and past episodes of Ag AM in Kansas, go online to agamandkansas.com.